Welcome, Mayor Niehaus. Thank you so much for joining me on Life Before the Virus on the road. And you are the mayor of Moab, Utah, which is where I am right now at this gorgeous hotel. And I'd love to hear how it's going with reopening. You're one of the first cities in the country to reopen. So tell us what that's been like.
Well, first I should say shout out to all of the parents that are schooling from home because the acronym for Mayor of Moab, MOM, Mom, and I've been doing that second job. So I just want to do a shout out to all the working parents that are working from home and schooling from home. It's been very difficult. And so you can imagine the pressure as mayor of a community, adding on the pressure of being a mom and schooling from home. It's been this has been a very difficult time. We shut down middle of March. And that was just as our season was ramping up.
Right.
Really, it's such a beautiful time to be in Moab between, middle March to Memorial Day weekend. And so, I mean, you're kind of hitting Moab at like our peak recreation season. And you can see why, right? The weather is beautiful and the clouds are big and fluffy and the red rock is just magnificent and you still have nice cool nights. It's pretty hot in the sun, but the shade is pretty manageable. Not a lot of humidity. And so it was really eerie to see Main Street empty for the past 2 months and to be a community that's of service to others. And, we welcome people into our larger home and, hey, what do you want to eat? And where do you want to stay? And what do you need? And what toys do you want to play with? It was very eerie to be in a place where we were like, okay, there's a pandemic and we can't be of service to others. And we're scared for our personal health. And we were seeing these hot spots. New York Times did an article identifying that it was recreation or tourism communities that were hit hardest first by this pandemic. And so we just said, all right, mid-March, we're shutting down. We don't want to get hit hard. And I don't know how you made it to Moab, but you certainly had to drive a car at least 2 hours, if not 4, from the airport, correct?
Right. We were originally supposed to fly into Vegas, but there are no direct flights from New York to Vegas. So we flew into Salt Lake City and rented a car and then drove.
And that drive was about 4 hours, 4.5 hours?
Yeah, 5 hours, yes.
5 hours. And it's a beautiful drive, right?
Beautiful, gorgeous.
But it takes a while to get here.
Yes.
So you can imagine. And also, I don't know if you've needed to go shop for some essentials while you were here, but the closest Walmart is 2 hours away.
So I have to move because look at the sun. It's following me. It's a beautiful thing, but I'm going to move.
Yeah.
My husband, one of the first things that he wanted to do was get his hair cut. Look, the sun's here too.
Oh my goodness.
I still need a manicure, pedicure.
Yeah. It's complicated. Yeah. And Moab's a very difficult place. We're a population of 5,000 people in the city, 10,000 in the larger Grand County area. And so when we think of services like salons and pedicure, manicure, we're very limited in what we have, to offer residents and visitors. Mm-hmm. And with this pandemic too, everybody's in such restriction that it, just kind of squeezes further the capacity of our town. But so we have this like rural and remote thing going on. We're rural and small population, remote in 2 hours from Walmart, 4 or 5 hours from the largest from a large airport. Mm-hmm. So now that I've kind of painted that picture, put that in context with healthcare.
Right.
So our hospital here is a 17-bed critical access hospital, but we do not have an ICU. Mm-hmm. If anyone goes to the hospital and needs intensive care, they are shipped to a partner hospital, whether it's to Colorado or up to Salt Lake. And shipping is very expensive. And, care is delayed in those circumstances. other than, you stabilize the patient and then transport. And so then on top of that element, we've got people out doing risky recreation. So you get in a mountain bike accident, you break your femur, you go to the hospital. Our hospital can treat for that, but now we're trying to understand how we're going to combine care for recreation and care for those that are going to be affected by this pandemic. So it's been a very complicated puzzle, locally being a rural remote community that lots of people like to come. I mean, we're set to service 5 million visitors, on the sweat of 5,000 residents. Mm-hmm. So it's it's a very delicate balance. And yet, yes, we as a state have decided to reopen, and reopen in a way that is more relaxed in terms of restrictions. So here in Moab, visitors are, requested, not required, to wear masks as they, move about town. You're certainly not required to wear a mask when you're hiking or biking.
Right.
However, you're asked to keep a mask in your pocket so that if you do come into contact with somebody and you're not able to physically distance yourself 6 feet, then you have a mask available. Our state did disperse masks to all of the recreation hotspots, Moab being the first. We got 75,000 disposable masks that we could pass out to visitors. And that was a huge help over Memorial Day weekend, so that people felt like, if they chose to be safe and cover their face, then they had the option to do so. And right. Employees were grateful as well. So yeah, that's kind of the landscape of what a pandemic looks like in Moab, and how we're slowly working on this visitor confidence so that we can reopen and recover the income that was lost this spring.
So with looking towards reopening, is there concern that tourists like me from New York City will bring the virus here? What's that conversation been like?
I mean, I think that it would be naive to say no. I think that there is concern about asymptomatic carriers. When we reopened for Memorial Day weekend, so we've been at 3 cases, all of which are recovered now, mm-hmm. for the duration of the closure. And then as soon as we opened, we got 4 new cases. Mm-hmm. So I think that, sent a message to Moab, like, all right, opening means cases. Do we have the capacity to handle it? The health department and the hospital do believe we have the capacity, but like all capacity, there are limits. And so we're just watching, how the virus is going to spread in Moab, with the hope that as visitors like you come to Moab, that you fiercely follow the CDC guidelines to keep yourself safe and others safe while you're here.
So the guidelines are the CDC guidelines, the same across the U.S. Are there any guidelines specific to Utah that come from the state level or from the county level down to you in the city?
There are still lodging restrictions, as you mentioned. We are right now looking at, today's Thursday, so our current health department order expires tomorrow, and so some restrictions are going to be, the lodging restrictions are going to be somewhat lifted. So there's going to be more hotel capacity for people visiting to stay. But in terms of, dining, we're lucky that we have a lot of restaurants that have outdoor dining options, and businesses have really mobilized to create a more welcoming and safer environment for patrons to be able to sit outside or do takeout. And we're just so lucky that Moab's environment, I mean, as you're sitting outside right now, it's like a great place to have a sandwich. We're not inundated with a whole lot of rain this time of year. And if it does rain, it's like the desert wakes up and you can smell things that you weren't smelling before. And so when it rains in Moab, it's kind of magical, and you might as well have a picnic outside anyway. The one thing that I would say to people in New York that are looking to come to Moab, here's the deal. You're not going to, travel overseas, right? You're not looking for international travel right now, right? And and it's kind of a trek to get to Moab from New York, as you've done,
Right.
and as you've illustrated. Um, it gets very hot in July and August in Moab. And so you're looking at 100-degree plus weather. But Moab is a great place for sunrise hikes and sunset hikes. And when you've been cooped up in your apartment, hanging out at a hotel, in a hotel room with really good air conditioning with a super sweet pool, is kind of blissful. And a lot of our hotels have really cool pools. And then if you have to work, you might as well work from a hotel room instead of home, right? If you're still working online. And it might even be quieter because you can send the kids to the pool while you get work done in the room. I do think that, what we're trying to really be is a safe community for our visitors and for our residents. A lot of Moabites are still feeling, concerned.
Mm-hmm.
Like I said, we saw the rise in cases since we reopened. And so like, I just ask visitors coming to Moab to really show Moab that respect by, with covering your face and washing your hands and just being really respectful of the people that live and work here. There are not many of us, and we want to be of service, and we certainly don't want to get sick, because then we can't, make you really great food and offer you a really great place to stay and take you on wild adventures.
It has been really nice eating outside. I know something in New York City, the restaurants are trying to advocate for the city to close the streets to make more room for outdoor tables. And that's not something they've been successful in doing so far. Most restaurants are closed in New York City. And here I've seen it's very fortunate to have the space to be able to serve patrons outside. And
Yeah.
I've noticed a lot of families come and not a lot of people wear masks who are guests at the restaurant because they're sitting there eating, but all the
Right.
staff that works there are wearing masks.
Yeah. And certainly, I mean, logistically, you can't wear a mask while you're eating dinner. But I do think that the restaurants are situating tables in a way that there's physical distancing between tables. So you can, wear your mask to your table, take it off, visit, eat, mask up, wash your hands.
Right. What can you talk to us about some of the politics with reopening and how that was?
Moab, I think when we first reopened, we saw visitors that were less risk averse. And so visitors that were less worried about the illness. And so there was less face covering. I think that's a safe assessment that we've seen, had of the reopening. And I think that as we remain open and move forward, the hope is that we're going to see a more balanced type approach to following CDC guidelines, or more positive approach. But there's been politically, conflict around wearing masks, conflict about how we reopen. It's just been, should we reopen? How quickly? We'd like to reopen so that we can, get our economy rolling and be of service to our visitors, but we want to make sure that we're safe. But the leadership in Moab has been pretty solid between the hospital, the health department, the city, and the county. We've all been pretty solid in leading together and being consistent with following the governor's guidelines, but also just recognizing that we're rural and remote and taking some extra precautions that other communities in Utah aren't.
And I noticed your background isn't typical of an elected official or a politician. You're a recently new mayor, elected in 2018.
Mm-hmm.
And your background's in a lot of nonprofit work and sociology. So I'd love to hear what made you decide to run for mayor.
Oh gosh. Well, if I knew there was going to be a pandemic, I probably would have thought twice. But yep, I was for almost 10 years an affordable housing developer. I started a nonprofit called Community Rebuilds, building affordable housing through a student education program. And the housing typology is straw bale construction with solar panels, like very, very groovy, nichey, affordable housing, because affordability isn't just the cost of construction, but it's when you put the key in the door. So I did that. And then before that, yep, master's degree in applied sociology. But, you know, when you land in a place like Moab and you say, gosh, I think this is my home, straight out of graduate school, you're like, what am I going to do with my degree? What am I going to be when I grow up? And having been an affordable housing developer, I interfaced with Moab City Hall a lot, and, you know, became familiar with policies, and just thought, well, you know, I'll put my name in the hat for mayor, because right now this city needs sort of leadership of somebody that has business experience and affordable housing experience. And so, yeah, and then Moab picked me. I think also coming off the tails of the election, where there was a lot of division with the election of President Trump, and people really feeling polarized. I think we saw a lot of communities kind of look to female leadership. So I think that was part of it too.
Awesome.
But yeah, I'm not a politician. I guess I am now.
Awesome. Thank you. Thank you so much for taking the time to speak with me and for everything that you're doing to lead the city of Moab.